We are the ones going to the field and educating the community members.
Out of 600 million of the world population of those that fall sick in a year, Nigeria produces about 173 million cases. It's up to 29% of that share in the whole world. That means
a regular Nigerian consume what they don't know. All they know is they go to the market, get food, and feed on them.
DRASA Health Trust is an organization committed to protecting public health. We believe that no one should suffer and no one has to die from preventable diseases.
Health of one man is the health of all.
This project generally aligns with our mission to build a network of health champions who are preventing diseases and saving lives.
Sanita too. To whom much is given, much is expected. That you've been choosing from your various local government, it makes you one of the special people there. You are like a change agent. As a commissioner for environment and natural resources, I'm putting this to you. When the change era in Oyo State, it's a privilege for this to have come to Oyo State. And what you'll be doing in the next 3-4 days is a life-changing thing. I beseech you to take it serious and be that change agent that we are all clamoring for. Thank you. God bless you all.
Food safety refers to a series of practices.
I am Associate Professor Andy Anyelewa-Chuka, one of the facilitators of this program. I believe that the people we are training, if they can go to the field and demonstrate what we have taught them within these 4 days, there must be great impact on themselves, on the people they will be talking to, and the food safety management in Nigeria.
My name is Sanitarian Adadevoh. I want to firstly appreciate the opportunity given to me through this program that is being organized by DRASA, Federal Ministry of Environment, and the State Ministry of Environment. There's some new names that I've not heard before, that I'm hearing for the first time. Through this program, I've learned that I'm one of the stakeholders in preventing foodborne diseases.
Foodborne diseases generally, you have vomiting and stooling. I am Moyosara Odumesi. I am the Community Health and Hygiene Project Associate at DRASA Health Trust. The environmental health officers, they double as the food safety officers. They are the health champions that we are training. With this project, we hope to improve their capacity to be able to identify and detect and also reduce, the spread of foodborne illnesses in their community. And at the end of the day, people are able to eat, safe food, and they don't have to die from, consuming food.
My name is Ayomikun Tayo. I am the Community Health and Hygiene Program Manager at DRASA Health Trust. This project is very important to DRASA Health Trust because it aligns with our goals and mission to always protect public health and prevent infectious diseases through education, advocacy training, which is what we've been doing in the past 4 days. We've been training environmental health officers on food security and food safety and all they need to know. So it aligns with our strategy of developing health champions who are in charge of taking over the community to ensure that everyone lives a healthy and safe life.
Food hygiene and safety is one of the pivots of environmental health, and having a training program to build capacity, to enhance skill sets for workers in the environmental health profession is very pivotal to ensuring food safety and hygiene conditions, food quality for the public.
My name is Chika Obala from Federal Ministry of Environment. The ministry has a lot of environmental health officers, which are also the food soldiers when it comes to inspecting and monitoring the food safety activities in the environment. So I think it's coming at a point where foodborne diseases and outbreak is becoming one of a public health challenge.
My name is Ayokunle Moleng. I work with the Federal Ministry of Environment in Abuja. We are facing series of foodborne diseases across the world. Even in country here in Nigeria, we talk of Lassa fever, typhoid, cholera, etc. These are series of foodborne diseases that we experience.
My name is Sanitarian Olarinde Abimbola Tete. We've been trained, we've been empowered, and now the application is very easy, simple. Going out there to discharge the duty as expected. Going out there to do prompt inspection and early detection of any awesome food item and ensuring that such is not being served to the public.
My name is Sanitarian Adadevoh Isaac. This seminar is timely. It has actually strengthened my capacity as food safety officer, and it has introduced me to scientific methods of reporting, which will actually strengthen my capacity and improve my work job as environmental health officer.
By equipping these food safety officers with the knowledge and the skills to be able to conduct their monitoring and inspection activities, to also do surveillance of foodborne illnesses, they are able to make sure that at the community level, the people that are selling food to other people in the community adhere to standard food safety practices, and they are able to provide safe food for people in the community, safe food for consumption basically.
With this training, the environmental health officer will be able to improve or step up their game a little bit more to ensure that regular Nigerians on the streets will get foods that are safe and healthy for them. They will be using their money to buy poison.
My name is Olorunsogo Temilaya Mobolade. Part of what I've learned in this very training is that physical examination of food is not enough. Rather, make use of the modern tools in order to get the accurate results of what you are trying to investigate.
My name is Sanitarian Ogundele Oluremi Jacob. I know that I've been advanced from this program. So many things were exposed to us that make us to know that food inspection beyond physical appearance, it entails even some scientific knowledge.
When there is food outbreak, it becomes a hazard, it becomes an environmental event. The ministry is also trying to establish that, and when the officers who are expected to be in the field have this knowledge, they can be able to report this in the surveillance system.
I believe that this project on food security is not just about preventing foodborne illnesses. It even gives us a sustainable approach to ensuring that food is safe over a long period of time, especially for the common man. It builds my confidence in ensuring that I consume very safe food.
Well, for the ordinary man is to see the end product of the training translate into improved food quality, food safety conditions. Once we see a reduction in this kind of negative or deleterious outcomes, then of course I feel that the program would have attained its set objectives.
After this program, I will improve more on my routine inspection, which they said is not only the inspection that is important, but continuous monitoring of what we are inspecting until they do what we ask them to do.
My sense of judgment during inspection to premises is only on visual inspection, but now I will include scientific approach.
Why are we not talking about infectious diseases? Why are we not talking about HIV and AIDS?
This thing can be cascaded to other local governments so as to have a one health approach as we preach, and so as to make the health of one man really be the health of all.
There is nothing that can stop us in achieving this. We've been empowered because through this knowledge and through this information we've had at our hand is a tool for us to discharge that duty as expected of us. So we are not relenting, aiming high to ensure productive health, promoting lifespan.
For someone that co-designed and co-implemented this project as a whole, I think it's fulfilling to hear that this is like a one-of-a-kind training for them. They are seeing tools that they can work with, and they are learning how to use those tools. They're excited about going into the field. They really value their work, and they hope to implement the knowledge that they've learned from this training in their various local government areas.
We appreciate the support of the Federal Ministry of Environment and the Oyo State Ministry of Environment and Natural Resources for being a part of the success of this project.